I didn't want to go anywhere. I didn't want to see anybody because I didn't want to make a fool of myself talking to them.
Chemo Brain is kind of a confidence buster because you don't feel as capable as an adult as you did before.
The anger, the frustration, it's just, you want to hit something.
From 1/3 to 1/2 of cancer patients undergoing chemotherapy suffer from what is referred to as chemo brain, or difficulty processing information at a normal rate due to cognitive inefficiency.
It's almost like having attention deficit, a mild version of attention deficit.
3 days later, I'd be asking the same question, and my kids would go, "Second time you asked that, Mom."
Studies have found that sometimes patients even experience chemo brain before chemotherapy begins. This type of cognitive inefficiency can range from subtle and noticeable only to the person to more severe. So far, research hasn't pinpointed a reason as to why chemo brain may occur. Factors could include cancer or its treatment, complications from cancer, such as infections or anemia, and certain medications. An inflammatory response from the cancer and treatment, like having the flu, and changes in hormones and other natural substances in the body may contribute. Some people may be more susceptible to chemo brain because of their genetic makeup. Chemo brain can have an effect on daily life.
I paid one bill 3 times. 3 times. I had to call the bank, I had to call the company, and I had to get my money back. It was frustrating. I said, why can't I do this? Why can't I do this?
You'd be in the middle of a sentence and you knew there was the perfect word to drop in, and you just couldn't think of it.
Chemo brain can make it hard to find a word during a conversation, but it can also make it hard to focus one's attention, multitask, and process as much information as before.
So they're actually functioning at the same level they were before, but at a greater cost.
It can leave patients both mentally and physically fatigued because they might have to exert more effort to perform tasks. They may be slower to do their normal activities or find it hard to complete tasks due to distractibility.
Oh man, I knew I needed diapers and I forgot. Let's go, I gotta go to the store, and I just had to, put them in something real quick and let's go to the store and get a bag of diapers and come back. I mean, I'd forget diapers more often than I should have.
In some cases, doctors can prescribe medications that can help alleviate these symptoms. There are also several behavioral and lifestyle changes that can help too. If you are a patient experiencing chemo brain, here's what you can do. First, be organized. Write things down, but do it in a way that you can keep track of them.
The worst thing you can do is write everything down on sticky notes and post them all over the place, because that's totally unorganized and inefficient, and it's not going to help much. You have to have a very methodical, organized approach to managing these symptoms.
Have a day planner or a PDA. Create a daily list of tasks. Prioritize these tasks and keep a running master list across weeks or the month. Have an end-of-day routine checklist. Use devices with audible alerts. For example, many cell phones can be programmed with reminders and alarms. Second, conserve energy. Start slow. Pace yourself. If possible, talk with your employer about flexible working hours or even job sharing. Do your most important tasks when you are most energetic. Delegate other tasks when possible. Take breaks between tasks if you need to. Aggressively manage sleep problems. Ask your doctor for a referral to MD Anderson Sleep Center if you're having sleep problems. Exercise. Third, minimize forgetfulness. Park in the same space or write down the location of your car in your day planner. Use a pill box to help keep track of your medications. Fourth, learn to manage stress. Place of Wellness offers a variety of classes like relaxation training, yoga, meditation, and even hypnosis. Recognize when you are stressed. It's okay to ask or seek help. Simplify your life as much as possible. For example, create a memory station in your home where all important items such as keys and purses are always placed. Have a phone that stores phone numbers. Use direct deposit. Use appliances with automatic shutoff. Here are some activities to be aware of that might sound helpful in improving cognitive function, but are of limited help.
People will say, well, maybe if I do mental exercises, that will sharpen my brain, so I'll do Sudoku puzzles or I'll do crossword puzzles or video games. What happens when you do those things is you get better at that thing, but it's not going to really help chemo brain symptoms at all.
If you are a family member or caregiver, here is what you can do to help a loved one suffering from chemo brain.
Just being there for support is the best thing, in being understanding and reassuring them that this is very typical and not to worry about it.
For me, it helped that we both could have a sense of humor about it. It's, you know, when you ask the same question the third time and somebody, instead of going, oh, what's wrong with her, they say, okay, that's third time. And we could both laugh about it.
It's very important to be positive. You cannot go through life being sad all the time.
I had to be much more methodical about my scheduling. I gave myself more slack, but I knew I had to be at work at a specific time and that I wanted to accomplish a certain amount during that day. And it may have been a lot less than I had bitten off the day before, but just laying that out there, I'm going to do this today, and then getting it done, it just gives you a lot of reassurance that chemo brain may slow you down a little bit, but it doesn't stop you.
For many patients, chemo brain improves after chemotherapy is over.
I feel better now. I can think a little bit more clearly. I still have my little quirks, you know. I forget where I put things, I forget what I'm doing, but it's not as bad as it was.
While chemo brain symptoms may improve for some, for others, it may not.
We're not sure why it persists in people, but we do know that it's very manageable and there's always something to do to help minimize the impact on their daily life.
As always, it is best to talk with your doctor about concerns or plans you might have about your plan of treatment. For a referral for a cognitive assessment, call the Neuropsychology Service at 713-792-0708. For more information about chemo brain, please visit www.mdanderson.org. There you can check out a complete list of classes and programs offered by Place of Wellness.